canine monocytic ehrlichiosis. Ehrlichiosis is a tick-borne infectious disease of dogs, usually carried by the brown dog tick. The organism responsible for this disease is a rickettsial organism. Rickettsia are similar to bacteria. The brown tick can be identified by its reddish-brown color. When full of blood, the body turns into a gray-blue coloring. Ehrlichiosis is a disease that develops in dogs after being bitten by an infected tick. In the United States, E. canis is considered endemic in the southeastern and southwestern states. There are 3 stages of the disease: acute, subclinical, and clinical or chronic. Acute stage, early disease. In this stage, infected dogs may have a fever, swollen lymph nodes, respiratory distress, weight loss, anorexia, bleeding disorders, like nosebleed for example, and lethargy, a lack of energy and enthusiasm. Subclinical stage, no outward signs of disease. It is often considered the worst phase because there are no clinical signs and therefore the disease goes undetected. The only hint that a dog may be infected during this phase may be after a blood sample is drawn when the dog shows prolonged bleeding from the puncture site. Dogs that are infected subclinically may fight off the diseases or may progress to the next stage. Chronic stage, long-standing infection. The chronic stage is the most serious stage of the infection and can be fatal. Dogs are likely to develop a host of problems such as bleeding episodes, lameness, eye problems, such as blindness, neurological problems, and swollen limbs. If the bone marrow, site of blood cell production, fails, the dog becomes unable to manufacture any of the blood cells necessary to sustain life: red blood cells, white blood cells, and platelets. It may be difficult to diagnose infected dogs during the very early stages of infection. Therefore, your veterinarian will take a thorough medical history of your pet. He or she will ask questions regarding the existing health concerns and when the onset of the symptoms started. They will also perform a physical exam. He or she will most likely recommend blood work. A complete blood count test, CBC, usually will show a decreased number of platelets and low red and white cells in pets infected with the disease. An ELISA test will check your pet's serum to detect antibodies. Another diagnostic test that may be recommended is the Polymerase chain reaction, PCR, test. This test helps identify specific genes unique to ehrlichiosis. To help your pet with his current symptoms, your veterinarian may prescribe antibiotics before all of the results of the blood test return. The sooner the treatment, the better. Dogs that have severe anemia or are experiencing bleeding problems may need to be kept overnight for observation and possibly require a blood transfusion. If your dog is dehydrated, he or she may need to be given intravenous fluids that contain electrolytes. Commonly, the veterinarian prescribes antibiotics of the tetracycline drug family including minocycline, oxytetracycline, tetracycline or doxycycline. The best way to prevent this disease is by checking your dog once or twice a day for any ticks. Anti-tick medications, like monthly spot-on treatments, can keep ticks from biting. Unfortunately, ticks and fleas today are becoming immune to these pest repellent ointments. So it is important that you still check them. To remove a tick safely, use a pair of tweezers to grasp the tick as close to the animal's skin as possible and pull gently and steadily. This method avoids the possibility of any infections. Thank you for watching. Like and subscribe to the channel for more videos.